Hi, welcome. Dr Mirhom, board certified psychiatrist, and I'm so excited to be joined by an expert today, someone who actually knows things about child and adolescent psychiatry, my good friend, Dr. Joshua Thomas, all the way from Houston, Texas, board certified child and adolescent psychiatrist with many years of experience treating the young kiddos and their families. Welcome, Dr. Thomas.
Thank you so much, Dr. Mirhom. It's a pleasure to be here. It's good to see you again. It's been so long. How have you been?
Good, good, man. I'm happy to see you. I love your office setup. You got the whole thing going there, the couches and the total shrink vibe is going well.
I'm just saying, I wish I had more degrees. I'm just going to show off my degrees here. There it is. There it is for all those who
Now we match. This
need
is
it in the
perfect.
background just to make sure I'm
This is all
qualified.
psychiatrists do, just compare degrees and just kind of see who's
Right,
good.
right. I saw 6 over there.
I
I'm
see
too
your
short.
six and I
What can I
raised you
say?
12. Well, man, I know you've got, all the credentials needed for our discussion. Thank you for taking the time to chat. And, I just wanted to jump right into it for you. I know there's been a lot of times where people have asked me things about young kiddo, behavioral health questions. And I'm like, man, I wish I had a great friend who was an expert in this so I can throw all these questions at him and then get his, perspective. And some things that people have asked me kind of here and there, as we're sort of starting to finally come out and like breathe a little bit, and see like sunlight and I get some vitamin D, have some post-COVID life. People are wondering, like, has this past year destroyed my kid's life as far as, a young kid who's never seen school and they've just been traumatized by stupid Zoom every day? Is there an actual uptick of mental health issues? Is there something, are we just noticing it more? Like, what do you think has been a balanced way to understand COVID and mental health for young kids?
I think the question is one, I think headlines or sells the news information, things like that. I think what matters most to people is how is their child doing, are their children
Mhm.
doing through this whole process, right? So the larger question, is there a rise in mental health concerns for children? That one we're gonna have to wait and really look at the data, see what pans out. Now there have been studies looking into this, mostly just kind of asking questions, are you concerned about your child's mental health, and polling. And so, yeah, we do see a rise in that. We are seeing rises in depression symptoms, anxiety symptoms in children. We do think it's a slightly accelerated rate because it's also important to bear in mind that even prior to the pandemic, we were seeing these kind of rises in reports of anxiety and depression. I think, so I couldn't tell you for sure yet, right? But what I can say is that anecdotally, at least in my practice and some of my colleagues, when we talk, we are seeing, wow, yeah, we're getting a lot more patients,
Mm.
whether that be psychiatrists, therapists, pediatricians referring. We do see a lot more patients. I would probably, if I had to guess, I'd probably say about 10-15% increase in the number of volume that we're
Mm.
getting. I mean, in fact, I had to hire a new employee just to kind of handle all of the phone calls and conversations. So we are seeing a
Wow. But to your point, though, I mean, you're absolutely right. Is that what's behind the question here is people are worried about their individual situation, right? Like nobody really cares about the stats all that much. I don't think anyone is going to go, like, oh yeah, you said there's a whole lot more, but hey, I'm worried about my kid. And parents
right.
say that, right? Like, what's up with my kid? Should I be worried? Some parents have even asked me, to be honest, they said like, I don't know, my kid seems okay, but the news is telling me that every kid is not okay. So I send them like I anyway. No, sometimes maybe your kid can be okay. That's fine. So I'm wondering kind of your perspective, when you're talking to families and I'm sure everybody curbsides you if you go to a barbecue or if you go anywhere and say, hey Josh, like, I don't know, when should I be worried about my kid? And, every kid has stuff that they go through and, all kinds of natural, normal behaviors and variation. But when would a parent be worried? What would you say kind of from a big perspective?
Right. I mean, I think there's a few factors we want to think about. Kind of, well, obviously, what you're noticing in the severity level of it. For instance, hey, my child seems kind of sad some days. My child seems a little anxious, or my child is, talking to friends or even talking to me and saying that he's having thoughts about, suicide. Right. Like, so obviously, what I try to help people understand is more familiar, people are more familiar generally with medical things, right? Like kids being sick. So what are the things that you're usually thinking about? Hey, my child's having a little bit of a cough and maybe sneezing a little bit, right? I guess before COVID, we would say, hey, maybe this is just a little bit of, a cold, right? Or maybe a little allergies, right? I think kind of same, depending on how long it lasts, if it's just like minor thing, you probably don't think too much about it. Unless it continues more frequently, it's like happening every day, the kid's getting sick, tired, can't get out of bed, missing school. If it goes on for a lot longer, you start to say, all right, maybe I need to, call my pediatrician, see what's going on, right? That's similar kind of idea that we think of with mental, or what I advise people with in regards to child and adolescent mental health, right? It's like, okay, if we're noticing they're a little down one day, we probably don't overreact, right? Child had a bad day, it can happen. Throw a little bit of a tantrum here or there, it's okay. Struggling a little bit with school, right? It happens. However, if this is something that you're noticing is going on for a while, or increasing in the severity, we would probably want you to, hey, talk to a mental health professional. It could be a school counselor. It could be your pediatrician. These are, it doesn't necessarily have to start with a child psychiatrist, but therapists can be fine too. Just getting a little bit of a consultation, checking in. These are all great ways to, be a little bit on guard, check in, make sure your child's getting the right mental health supports.
I hear you there. So I'm definitely hearing, severity of it, time frame, multiple people kind of noticing it. And I love what you said there, just kind of maybe a consultation, because one of the things I think people want to kind of clarify is, does everybody that come to you immediately get placed on 100 medications? Like, is that the usual thing? Just you go to a doctor, so boom, medicine. Or if I'm a parent and I'm kind of worried, is it possible that my child who's struggling may not necessarily be on medication? Or if they are, is it possible that it's kind of a gradual conservative process?
Right. I mean, I can't speak for every child and adolescent psychiatrist, but if I kind of use
just the good one.
American Academy of Child and Adolescent Psychiatry practice parameters and recommendations, we often see is that it's pretty much the standard to have more than just kind of one session oftentimes, or to have sessions where you're spending time with the child, time with the parent. And the reason I bring all this up is, it's not so much, hey, you're going to walk in, have a 15-minute visit, and we're going to put you on a medication, right? A lot of it is going to be, we're going to have a little bit of an intake process, get to know your child, get to know your family, get to know your values, understand the concerns. Oftentimes at the end of even a 2-hour session where I interview the child and the parent, I'm telling them to come back, in a week or so, because I'm going to spend some time collecting additional information, contacting teachers or sending forms to other family members to fill out. And this whole process is designed to see, is there truly a mental health condition, a disorder that needs treatment? Once there, the recommendations follow pretty similar guidelines. I mean, in certain cases, yes, medication may be indicated, but interestingly, with children, adolescents, oftentimes the first line treatment looks like therapy. Many a times, it's reassurance. We're just telling parents it's okay. Your child's doing okay. This may be playing a role. Here are some preventative strategies or supportive strategies for your child to take. As parents, these are things that you can do. And it's really interesting. What I find is that oftentimes parents will bring their child in, the parents will talk, I'll talk with the child too, we'll all have this good conversation, and the child will walk out doing a lot better. No medicine, no therapy, nothing. But just the validation, being heard, when parents, or the child's kind of understanding, right? Keep in mind, they have a child's understanding. We can't give them an adult mind. Is, I'm weird. Something's wrong with me. I'm the problem, right? Like they may be embarrassed to talk about it. They may think their parents won't understand it, right? But all of a sudden, their parents are, what? I said one thing about being sad or down, and here we are talking to a doctor. You're taking it so seriously, and the doctor is validating to me. You guys are validating to me. It's pretty amazing how all of a sudden what became this very personal, scary, unsure thing becomes actually something that we all share and can understand and work together and kind of team approach it. So true. With all that being said, yeah. So yes, no, most kids aren't walking out of here with a prescription in hand. Oftentimes it's a plan to meet again, talk some more, do therapy or other first-line treatments that often beat out medication.
Well, that's so true, man. And I think it's really powerful what you're saying there, like to just not have that feeling like you're worrying alone anymore. I feel like there's now a team of people who cares about you, professional and your parents, and there's this sort of, like you're saying, this validation happens, and that in itself can be therapeutic. But what about though, let's take kind of the opposite of the spectrum for a second. You know, some parents, maybe when they're told, hey, the school, maybe the teacher is saying, hey, I'm a little concerned about, you know, little Johnny here, or whatever, right? Whether that comes from a pediatrician or a teacher or a family friend. And I don't know if this ever happens, but I've seen it with even like parents of adult children or like in their 20s who get a little defensive. They're like, oh, like maybe this means I'm a bad parent, right? This means like I must have messed something up. If my child is struggling with feelings of depression, like why? I gave them all this good stuff. I just bought them a new toy. You know, I had a parent literally tell me that, like, well, a brand new awesome toy. So that's cool, but it might not be the answer. So how do you kind of navigate that discussion without, if you're seeing the parent getting a little bit defensive or getting a little bit, you know, blaming themselves essentially, how do you kind of walk them through that?
Right. I mean, I think it's natural, right? I mean, parent first question or first thing they're going to think about is like, what did I do wrong? Like, how did I mess up my kid? What should I have done something different? And oftentimes, just kind of remind parents that, you know, children, and they're in their own world sometimes, they're in their own minds, right? A lot of what they're interpreting or seeing from a situation is not, like their perspective may not actually line up with what you were intending for them to understand or see in the world or the friends or what's going on around them. And I guess bear with me a little bit, just trying to explain this idea of, you know, you've heard of that saying before with our kids, like, now that we're adults and we have our kids, right? We're gonna say, what did you hear what I said? You know, we'll use that comment just to make sure they heard, you know, that they were listening. To take out the trash. Did you hear what I said? Take out the trash, right? And you just want the kid to repeat it back. But we kind of turn that a little bit, or give it a little different of a adjustment to it, just saying, when you ask your kid that, you know, you can actually find out, like, what did you actually hear me say? When I said, gosh, I asked you to do this, you didn't do it. I need you to do this, right? You may think what your child is hearing is, look, I get it. You made a mistake. You didn't hear me. You were playing your video games. I'm just going to repeat it to you because I need you to go and do it. Your child may hear maybe a lot different. What they may be hearing is something like, I never get it right.
Wow.
Always having to retell me things over and over again. And you must really, like, I am making your life harder. Right? That's not what you wanted your kid to hear, but that's just what they heard. So we'll use that. I'll often tell parents that, you know, hey, you know, when you ask that question, genuinely be curious. What did they hear you say when you tried to correct them, right? So I bring that specific example of these ideas up in this kind of idea of like when parents are coming to me saying, what did I do to mess up my kid? It's like, no, it's not about that. Oftentimes it's just miscommunication, and you're a great parent. You're doing your best. But you can't control for everything, every way your child hears what you say, or the way your child hears what their teacher says or what their friends say. So oftentimes it's better to just be curious and be a good listener and not worry about who's to blame, right? Maybe you will learn something. Maybe you'll learn something like, oh my gosh, when I said that, you thought I was upset with you? No, I'm so sorry. I never wanted you to feel that way. I was just having a bad day. I was, you know, busy at work. I know you guys were all homeschooling and I just couldn't hear the Zoom meeting and I just, you know, got upset. But I didn't want you to feel like you were some burdened. I'm so sorry. I never wanted you to feel that way.
I love that. I really do, because it's amazing how much information you can find out with that curiosity. Like you're saying, that is really good advice. And I'll tell you, on sort of the later end of life situation, when I'm seeing these adults, just a patient last week was telling me how one of the things that she thought her mother was saying to her, or like the way her mother made her feel, or it was communicated, has stayed with her decades later. This is now someone, you know, much older in life, and there could have been some, maybe if there was fantastic guidance at the time, there was a great child psychiatrist who can sort of interpret the miscommunication there. There could have been a different discussion now, what we were having. But to your point here, in terms of you're saying, sometimes there are these things that get in the way of communication. And one of the things that you mentioned, if the child is not, you're not connecting with them, and sometimes they can isolate into their own little world, maybe seeking that validation, seeking that understanding from friends, right? Is that the most important humans in their lives. And sometimes those friends come in the video game world, and the bane of so many parents' existence, right? Of just saying, I wish I could just take the PS4, 5, 6, and Xbox and throw out of the window. Right? Are video games the worst thing in the world for kids? Is there, could parents just say, no video games forever? Or is there something that parents should also understand about video games and the role in the child's social world? What's the scoop here?
Right, and that's again an area where there's going to be a lot more research. We're going to hopefully understand this a bit better. I think we do get worried if we have a kid who is playing video games all day and not attending to their other needs, their social needs, their educational needs, etc., right? Family needs. So I think that, is one group where we would be much more concerned about. But nowadays, it is a lot more complicated, the video games we're playing. Now, I'll be honest, I haven't played a lot of video games as of late. Growing up,
missing out, man. Missing out.
Yeah, I know, it's amazing, right? Like so I think that answers your question right there about how I'm completely missing out. But that's the idea, right? Like these video games have gotten a lot more complicated. I'm sorry, not complicated. It's more social, more interactive. They definitely draw your attention in and can do it for hours. But with that being said, especially during this pandemic, I mean, it's kind of been the lifeline for a lot of these kids to still communicate with their friends, to enjoy it. I think we even see kind of rises in kind of, not just boys, I think growing up, there's a lot of boys playing video games, but nowadays, girls are participating, everybody's participating now. It seems to be a great way to socialize. So what I worry now about is when we start to try to restrict it without giving good reason and value. Right, to why we're restricting it. I think there's a lot of, lack of understanding, lack of awareness from parents about what these video games are and what they're doing with them, like how they're communicating, how they may be improving some social aspects for these kids, especially during this pandemic. I worry that they're missing the point of, let's say, the American Academy of Pediatrics saying, hey, let's limit screen time to 2 hours a day. They'll say, oh, it must be bad for their eyes or something. It's like, well, no, we just need them to exercise. We can't have them sitting around and not exercising, right? So what I would say when it comes to these kind of video games, I don't think there's anything particularly inherently wrong in the video games. In fact, there may be a lot of value to it. And I think it's important that parents explore that with their kids, right? Like, hey, what are you playing? Why you played for 8 hours today? It's like, well, what are you doing for 8 hours? Let me learn about it, right? Let me understand what's going on in your video games that keeps you there for 8 hours. Because I think a lot of our assumptions ends up being, oh, man, I could never play Madden 95 for 8 hours, like something must be wrong with my kid, but, nowadays, like, you can, because you're actually interacting, the games are complicated, it's a lot of fun. So I think that's, what I would try to inform parents, or when I talk to my parents here about it, it's like, well, first find out what video games your kids are playing, who they're playing with, how they're playing. And if you're really worried about the amount of time that they're playing on the games, what is your concern? And make that known to your child, right? And maybe even make it known to your pediatrician, or consult with a psychiatrist or mental health professional about what that concern is. Like, for instance, I'm worried that they're gonna go blind. Well, it's like, that's probably not a good enough of or we don't have enough worry about that ourselves. Like, we're not worried that watching the screen for 8 hours is going to make you go blind. But if you're worried that they're not active and they're gaining a lot of weight, and that's not good for their health, or they're not physically getting out and meeting other people, and you think that's not going to be good for them socially, instead of telling them not to play video games, we would recommend promoting the thing you want them to do. Right? So not saying, hey, don't play 8 hours of video games. Fine, what do you want them to do during the other time?
Right.
Play 2 hours of video games, but I want you to use the other time to do these things because it's good for your health, right?
Mm.
You're not going to get an argument from a child if you're saying, hey, I mean, you may get a little bit of fussiness, but it's harder to argue a point
Right.
of, hey, I don't want you to play video games for 8 hours a day because I want at least 1 hour of time spent with family. That's important.
Right.
Or
Right.
we need to have an hour of time exercising,
I
right?
love that.
I think that's harder for a kid to be like, I don't need exercise. It's like,
Right. Right.
right?
No,
So you need to do that. It works better.
I like that a lot. And I think especially, I'm hearing kind of an undertone of humility that you want the parents to kind of have, that even the possibility that we may, parents may not have it all figured out. And they have to sort of approach the child and learn about a different world. It's surprising sometimes to parents that kids know a lot more about technology than the parents do. And there are a lot of things you may not really get. And the more you can sort of understand your kid's world, the more you can engage them in it. And then the more that communication can be better. Of course, the caveat to all this is if your kid is bad at video games, if they just keep getting beaten in 2K, they should stop playing. I think that's the recommendation from all psychiatrists, professionals. You got to be good to play.
Right.
I'm just kidding. I say that to my patients sometimes. I'm like, if you want to play one game of 2K, but if I win, no more video games for you. That's just how it's
That's a good point. I mean, I think as far as parents are concerned, it goes back to that curiosity, really understanding what these kids are doing, what they're getting from it, because going back to that idea of what they hear, right? The perception they get from what you're saying, right? If I say to my kid, hey, you got to stop the video games, no more video games for you, right? What your kid may be hearing is, so you just want me to be bored all day. Right? Like, you don't want me to talk to my friends anymore. Right? Like, it could be that, like what you just told them not to play video games, but what they're actually hearing, and what in many cases you're making happen is like, now they're bored and they can't talk to their friends who are all hanging out playing video games together.
It's a remarkable disconnect, what can be said and what can be heard. I mean, that's true for kids and parents. That's true for, I'm sure you counsel relationships as well, and folks who are in really in all kinds, whether it's professional relationships, romantic relationships. What you say and what is understood and what is felt behind what you say is not always the same thing. Surprisingly, a lot of people. And I think one other example.
The point too there is like, it's not about like blaming people, dude. I want to be clear here. It's just that we got to be curious, right? Like, I mean, it's not like, oh, are you 51% to blame or 49% to blame, or like, is it, there's things that can happen. It's just miscommunications happen. It's not about blame. Sometimes you add an extra, I don't know, texting your friend, you add an extra end to the word diner, right? And it says if it's dinner, and there's just a miscommunication, right?
May or may not be an inside story that
has to validity. It's just
that. Of course, in that situation, you were wrong. Anyways, moving on. But like you said, though, communicate, because there's so much to grow in communication over the years, right? Like, we've known each other for decades, right? So there were times that we've communicated then, and we've maybe gotten a little bit better at it now. And it can be fine-tuned, if it's not like to your point, it's not a blaming issue, but it's a growth issue that parents and spouses can become kind of more equipped. And I think the other element of this communication bit too, as you were saying, kind of as you're learning the support network of a new family, their immediate family, perhaps friends, one umbrella of that support network too is sometimes the faith communities, right? And they can turn to, your local church for support. And sometimes the feedback I've gotten from families is, hey, like, I went to my church for support. I wish they were able to kind of understand a bit, and I wasn't sure if they really got it. Versus sometimes, like, I spoke with somebody actually an hour ago before we spoke, who said, oh my goodness, I've never felt more supported in a church. My priest had a great mental health background, so they walked me through things from A to Z, and I felt like it was like a true hospital extension, and there's been sort of everything in between. So in your experience and kind of from your perspective, what would you want the faith community to know or sort of consider when we're dealing with families who are perhaps struggling with this whole mental health world?
Yeah, I think one, the faith community has a huge, a responsibility, a position of privilege to work with these families, with these children, but adults, sure, in helping them around their spirituality. And studies will show the value of spirituality in supporting our patients and supporting their mental health care, their physical health care, everything, right? So I think, when I'm talking to the faith community, it's like, one, thank you, and you play a big role. And, I think this is a integral part for a lot of patients' physical and mental health well-being, right? And so with that comes a lot of responsibility, right? And so what I would say is that you don't have to go it alone in the faith community. You don't have to feel disconnected from the medical or the mental health community, that we all can be part of a community working to support a family. We're not, or very rarely, I should say, in conflict with one another. If you're working and helping somebody around their faith, it's often helping support their mental health. And if I'm working with them, even if it's prescribing medicine, oftentimes that is supportive in treating their depression, anxiety, ADHD, whatever it is, that then further supports their spiritual journey and their faith. So there's, I think sometimes I'm in Texas, so it's maybe a little bit different, but we do sometimes feel that there's we're challenging each other somehow, that you're either picking, a psychiatrist or mental health care, or you're picking, a spiritual way of getting better. And that doesn't exist in my opinion, at least in mental health care. There's just no way that we could separate those and hope for success for a lot of our patients. So it's I guess that would be the thing I would want these communities to know, is that we totally partner. It would make a lot of sense. Nothing that we do would have to contradict each other.
Right. No, that's very wise, and it goes in line with the American Psychiatric Association had this formalized partnership where they put out wonderful resources together to really speak to your point, the fact that we're on the same team here. We've got different roles, right? We're not going to be necessarily the ones who take all of the spiritual care, and not every priest will prescribe medication, right? But every team member has a valuable role, and the more we can kind of work together, the better it is for the patient. And you can kind of see it from the patient's perspective. Is like, wow, wouldn't it be nice if everybody in my team was, cohesive? They all kind of saw that they're not at odds at all. And of course, like, we can be fair, that there are some historical reasons why psychiatry might have been a little wary, faith community might have been a little wary. But the reality of, just like you're saying, is that today there's no real source of conflict. And the studies, the data really confirms the fact that the better we work together, both on an individual and a family and a community level, because it does take a village to be able to approach on these mental health concerns. And speaking of that, I know it takes a village, and I know, Dr. Thomas, you've got many more ideas to share with us, and I've taken so much of your time today, and you could be seeing tons of families in this meantime. So I just want to take a second to just appreciate you. Thank you for the work that you're doing. I know as a close friend of yours for all these years, I am very fortunate and grateful that there is someone like you in this field, that when a child is struggling and their family is struggling, that they can go to like a brilliant, kind, compassionate doctor. And I'm happy to get to call you a friend, man. So thank you for taking the time to chat with me.
Yeah, I'm honored. Thank you so much for having me. I hope this, helps out somebody out there, some of your listeners. And of course, just wanted to reflect back to you. I'm proud of you. I am because you've done such amazing work, and really love these videos. I've been watching them. They're always entertaining, enjoyable. I hope this one lives up to the Dr. Mirhom standard.
It'll be the best one.
Is it? Yeah, okay.
Absolutely.
I'm honored. But again, congratulations. Keep up the amazing work. I love showing my videos your videos off to patients and others too. So it's always fun to share your videos on Facebook and whatnot. So
thank you so much.
Well, thanks again. I appreciate it.